Planning for a healthy postpartum recovery. Tips from a postpartum nurse.
Hello, and welcome to the Mothers of Boys Survival Guide podcast, your go to resource for tackling the challenges of raising boys. I'm Cheryl Bond, and I'm joined by my co host, Susie Shaw.
So, this topic was requested by a member of the mob, Mothers of Boys. And next week, we will follow up the conversation with an experienced psychologist. So, stay tuned for more.
Well, in today's episode, we're helping new moms feel more prepared for the postpartum journey. Nurse Penny Tillman joins us today to share practical tips for a smoother recovery and a stronger start at home. Penny has been a nurse for over 30 years. She has extensive experience in the field of pediatrics and also spent time working as a coordinator for evidence-based programs and teaching for a local Department of Aging and Disabilities. She's the mother of 6 children. Yeah, wow. Ages 16 to 27. Penny took time off to spend time with her children in the early years and then later returned to the hospital setting to pursue working as a nurse with mothers and newborns. Penny, we're so happy to have you here with us today. Thank you for coming. Welcome.
Thank you for having me.
You know, I've had 4 kids and Susie's had 2. And we know the roller coaster ride that comes with, adjusting to having the new baby, the healing, the exhaustion when you get home, and then trying to juggle life once you get home.
Yeah, I can't even imagine having 6 kids, Penny. I mean, because I stopped with hands. I had 2 hands, I had 2 children. Yeah. So what was it like having 6 for goodness sakes?
Busy. And still busy. And busy when they're small and babies, and busy as adults and high schoolers. So yeah, it's just it's pretty crazy. But I think I do believe that we're only given, what we can handle, and sometimes we don't know what we can handle till we try it. And for me, I think it just worked out. Although the first 2 were a bit challenging. They were 15 months apart. And that
Wow.
was the hardest time. And then I had 6 and 11 years, but what happened was the older ones started jumping in and helping, like most kids like to jump in and do something. And my oldest daughter was very instrumental in helping with the younger kids, and she still does. So I was grateful for that.
And
Yeah.
you have boys too, right?
I do yes, I do. Number 2's a boy. Number 5's a boy. Good to have those boys in the mix, I think.
Yeah.
You're an expert for sure. So can you walk us through what happens in a mom's body after birth, hormonally, physically? I know there's so much going on. And what should new moms expect in those first few weeks?
So there's a lot going on. There's the obvious, I guess, would be healing from delivery. You're looking at either, if you had a vaginal delivery, you may have a tear, you may have lacerations with repair, episiotomies. So you're looking at that part of it. And you're also watching your uterus, which has gotten pretty big with a big baby in it, and we're watching it shrink down as you progress further into your postpartum period. So we're looking, that's a biggie right there, is you're seeing your stomach sort of shrink back to normal. So with the uterus, people complain, there's cramping, it hurts, but that's sort of a good thing, because that's how your uterus is supposed to cramp, so that it does shrink back to your pre-pregnancy size. So you're seeing changes in your body in that way, but also hormone levels, they start to dip. You get a little emotional. and
Hmm.
sometimes a little more than emotional, but and you're dealing with taking care of a baby and you're dealing with taking care of yourself, and there's a lot going on.
In your experience, what has been the biggest concern for moms as they head home?
I think it depends. So if you're a first time mom, you're looking at how, what do I do? We get a lot of people who, they don't know how to change a diaper. They don't know how to swaddle a baby. You're breastfeeding, and you want to make sure that you're feeding your baby and that they're getting enough. And so I think that it depends on if you're a first time mom or you're a multi-para and you're having number six, it's sort of a different, but we all want to be that mom that does everything well, I think. I mean, as women, we want to be the good mom, and we want to look good, and we want to, there's all these expectations, I guess, for moms. And
You want to do
yeah,
it
just
all. We want to do it all and do it all well.
yep.
Hmm.
And also, I mean, pain. Like, can I go up the stairs? Am I going to be able to pick up my 2-year-old when I get home? Am I going to be
Hmm.
able to do? Can I go for a walk? Can I cook dinner? Am I going to be able to do any of this? There's a lot going on, for sure.
I remember feeling very stressed and about breastfeeding, and with my firstborn, and and he was a very big baby. He was obviously used to eating, and and I just think I was too exhausted to make much milk, you know? So what are all those elements that go into those early days when you bring your baby home, and how do you deal with those?
Like, well, first of all, know that um when a baby's born, you don't automatically have all this milk available, right? Also know
Mhm.
that their tummies they're about the size of a cherry, so they don't need a
Hmm.
lot either. But I feel like sometimes we'll hand somebody a bottle. Oh, give them a bottle, and they're, oh, should I give them the whole thing? No, 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 no. And then there's
Mhm.
the breastfeeding. Am I making enough for my baby? Do I have enough to support their needs? And just sort of know that you have to trust the process and your body's ability to provide for that baby. And with breastfeeding too, there's so many benefits to doing that yeah, it's pretty overwhelming to know that when you're breastfeeding, your hormone levels, the oxytocin is helping your uterus cramp to get back into your pre-pregnancy size, but it's also helping you bond with your baby because it's the love chemical. And so you're basically looking at your baby, and you're falling in love with it. You're bonding well, and it's just a beautiful process, in my opinion. But,
Mhm.
that being said, it's not, it can be very stressful for some women as well. So,
So I've read that 1 in 7 women, approximately 14%, experience postpartum depression, PPD, after childbirth. So what are the warning signs that you suggest that moms look out for as you're preparing them to discharge from the hospital, and what should they look for, and if they're feeling off?
with postpartum depression, we give everybody a scale to fill out. We look at numbers, and it looks very much like a scale that you might see at a doctor's office when they assess you for just depression. But if you've experienced depression before you became pregnant, or you had a history of anxiety, you may see those symptoms become a little bit more prevalent after you've had a baby because you're dealing with those hormone changes. So we're looking at things like joy, like what brings you joy? Do you want to hold your baby? Do you want to care for your baby? Um, are you feeling sad? Are you sleeping? I mean, there's so many things that are different that are not your baseline that all of a sudden become, a little bit more. Are you sad? Are you crying more? It's not just the baby blues anymore, which I think a lot of people experience initially due to the hormone changes, but it becomes a little bit more exaggerated.
Well, how soon can it come on? Can it be sudden, or is it usually a few days later? Is it all of the
So
above?
I think that when you're experiencing like the baby blues, you may see that show up while you're in the hospital, maybe the first couple of days, but it becomes more of an issue if it continues and even into a couple of weeks after you've had the baby. Maybe even 6 weeks later, you're finding that I just don't feel good. I just can't do this, and that comes on due to, well, anxiety, being tired, you're exhausted, you're not sleeping well, expectations, just feeling like you can't do this anymore. Um, and that, yeah, those would be reasons to call your provider. Or if you feel like harming yourself, if you feel like harming the baby or anybody else around you, that it's even more severe.
And so the symptoms seem to be more exacerbated, feeling overwhelmed, feeling depressed, beyond exhaustion, more emotional roller coasters than typical. What are the steps to do when you feel like that?
So when you feel like that, if you're at home, I think it's important to know who are your support people. Who can I call? Who can I rely on to come over and let me nap, or to feed the baby, or to play with my 2-year-old, or to do a load of laundry, or all those things that we're trying to do and we're feeling overwhelmed by. And also, I'll realize that there's no perfect way to mother. Your expectations of yourself are probably the harshest, right? Like, don't you think you're
Hmm.
I expect myself to be able to do this.
Mm-hmm.
I'm sure they do. I want to look good.
Right.
I want to be that mother that, people, oh my gosh, did you see her? She looks so good. And look at her kids. They're all well dressed. And, we have it together. Realize that you don't have to have it all together all the time. You don't, I mean, or any of the time at that. But
Do you talk to the moms about that when they're leaving the hospital? Do you help them set realistic expectations for themselves?
um, if they seem open to it, yes.
Yeah.
Yeah, I do.
What do
Um,
you think are the most important things that they should focus on to make sure that they are supported when they go home, and that they stay healthy and they have the right and proper recovery? What are the most important aspects of having that kind of experience when the mom goes home?
it's important for a mother to focus on taking care of herself. Um, we we talk to the moms about um, warning signs, physical warning signs as far as like recovery. They'll have a list of when to call your doctor, when to call 911. Expect this, if you had a vaginal delivery, um, you go home and all of a sudden you passed a large clot the size of an egg or larger, call your doctor. you know
Mm-hmm.
let somebody know. If you're soaking through one or more pads, if you're starting to get dizzy, if you're not eating well, if you're not, all these things that have to do with a mother's health, I think, are very important. And if you're breastfeeding on top of that, of course, that can lead to more stress. So stress management. Don't
Mm-hmm.
don't spend all day in bed. Go, try to get outside a little bit.
So what are the, signs that mom should look for when something might not be healing well, or there are signs of concern?
So if you've had a vaginal delivery, it's going to be a little bit different than if you had a C-section. So with a vaginal delivery, if things aren't healing properly, you may start to bleed more than you were bleeding at the hospital. I mean, normally the bleeding will diminish and it'll become something similar to like a light period, right? And that will pretty much subside within at least 6 weeks. So you're looking, if you have an episiotomy or a tear, that is, that's something else you want to consider. I mean, is there a foul discharge? Are you experiencing more pain instead of less? Um, does it feel hot? Or are there any signs of infection, when you assess that area? Same with a C-section. You're going to be looking at that incision a couple times a day to make sure that there's no redness or swelling or any kind of oozing coming from the incision site, that everything is still intact. It's not open. That you're keeping it clean. If you're taking a shower and you're standing in the shower and letting the soap sort of run over it, make sure it's clean. Towel yourself off with one towel and maybe take a clean towel and clean the incision site or just dab it to make sure that it's staying dry. Make sure that it does stay dry because we know that if the incision's moist, that it can lead to infections. So those things, if your pain level it continues to be, 7 out of 10, then you're going to call your doctor. There's something wrong. You may not be healing right. So there's no harm in calling your physician. It's better to ask for help than to try to soldier through it.
Yeah. Well, I was always told to sleep when the baby sleeps. Is that advice you give?
In the hospital. Yes. Yeah.
When they go
Yeah.
home, do you still give that advice?
I would give that advice. Yeah, because when
Yeah.
we're sleep deprived, we're exhausted, and you have to learn to sort of sleep when the baby sleeps, but also realize that just because your baby's asleep, doesn't mean you don't have to feed it. I think I do see a lot of people in the hospital like, oh, the baby was asleep, so I didn't want to wake him up to feed him. And I'm like, no, you really have to feed the baby. So, if you're breastfeeding, you need to be feeding every 2 to 3 hours. If you're formula feeding, you probably need to be feeding a little bit, or a little like every 3 to 4 hours. So that gives the mom periods of time to sleep, I think.
Hmm.
The baby's sleeping after that. If your baby sleeps, I
Yeah.
you're one of, yeah, I had one that didn't like to sleep, so that's
Yeah. Yeah. I had a colicky one and that was really hard. And he probably wasn't colicky, but he didn't sleep much. And so how do where the line between just overall exhaustion and being overwhelmed ends and postpartum like depression begins?
I just think if you have any of those concerns, you should call your physician and talk to them about the problems you're having. Never be afraid to reach out to anybody. I mean, if you're feeling overwhelmed, overexhausted, you need you need to know that it's okay. You're going through a lot right now. Um, there's that learning curve, and we have to know when to reach out and get help from our healthcare professionals, or if it's a 911 call, or if it's a call your friend moment, then that's okay to do that.
Yeah, I think it's important to stress that women, we don't have to act like we're super strong and we can get through it and we don't need help. Like I think you can't go wrong asking for help. Are there any specific items you think the moms should have at home for the recovery, or any supplies that are must have supplies to make sure that they physically are recovering?
So when we send our patients home from the hospital, they have pads. They have Dermaplast and witch hazel pads, which actually help with the tear or the lacerations or episiotomies, whatnot. We send them home with something called a sitz bath. Do you guys remember sitz baths?
Oh, I remember.
Mm-hmm.
I remember those.
Yeah,
Woo! Yay!
I know, right? It
I
does
think
sort of
I
soften
used
the
it for
stitches.
the first month actually.
Yeah, yeah.
Yeah.
I mean, especially if you had large babies like you guys did.
Mm-hmm.
Those come in handy.
Mm-hmm.
Um, we send people home with Tylenol and Motrin. If you take them at the same time, it gives you a really nice, adequate amount of pain relief. So maybe have some Tylenol and Motrin at home to help with that. Dermaplast, witch hazel pads. Yeah, those are nice.
Must-haves.
Yeah,
Okay.
must-haves. Preparation H, if you have, if you had a hemorrhoid or think you might have a hemorrhoid.
So I had horrible, horrible hemorrhoids. Thank you very much, Ernest. And I remember discovering what I've called since magic hemorrhoid foam. And it was some sort of foam that the doctor
Yeah,
ordered, and boom, it, all the difference in the world.
Wow, magic
nice.
foam.
Magic foam. So I don't know what
Magic.
it's really called, but it was magic hemorrhoid foam. I just go to the doctor and say, please give me magic hemorrhoid foam. Um,
Anything that works, right?
yes.
That's great. That's great.
Well, Penny,
Yeah.
before we wrap up, are there any other resources that you can provide to our listeners to help them as they leave the hospital and make their journey home?
First of all, your physician. Second of all, if you feel like harming yourself or the baby, call 911. That's a 911 call. If you have chest pain, seizure, any difficulty breathing, thoughts of harming yourself or the baby, you're going to call 911. Okay, don't hesitate. Postpartum support hotline 1-800-944-4PPD, postpartum depression. A national maternal mental health hotline 1-833-TLC Mama. I love that. MAMA.
So, Penny, we're going to next week interview a psychologist and who specializes in counseling, for specifically postpartum depression. And I will take resources from you and the doctor and create a resource page on the website. So, visit
Yes.
motherofboys.life to get more resources. And we ask all of our guests on the show to give us a mantra, to tell, something that a mom can say to themselves, in their mind. So what would a mantra be for you as a mom's walking out the door?
So fill your cup with the things that are most important and let the rest filter in. So your priorities, yourself and the baby. Don't worry about anything else. Let it go.
Wonderful.
Yeah.
Yeah.
Well, thank you, Penny. It's been such a wonderful time having you here today. And I feel like our mob community is walking away with really great practical advice that they can use as they transition home. So thank you so much for your time and all your wisdom, and particularly all the compassion that you show the moms and the newborns in the job that you do. So thank you so much.
Thank you. And thank you for allowing me to share. This is really a gift. Yeah, thank you for the invitation to be on the Mothers of Boys. So I hope that something I said can help someone else have a better experience or a great experience with their time as a mother.
And thank you all for joining us today. Follow the Mob on Facebook, Instagram, YouTube, and your favorite podcast platform. Be kind to yourselves, moms, and have a great week.